What happens when a government prioritizes control over choice? Nations must bet on freedom or fear. When Prime Minister Keir Starmer endorses a generational and outdoor smoking ban, he isn't merely making a health statement. He's casting the die for a new kind of governance, one where individual liberty is sacrificed on the altar of bureaucratic certainty. Let's be blunt. Smoking kills approximately 80,000 people in the UK every single year. Fact. The cost to the NHS and taxpayers is undeniable. But is legislating morality from the top down the right answer? Starmer's approach feels less like a public health crusade and more like a state land grab of personal responsibility. He's promising a preventative model of healthcare, yet that phrase is being twisted into a justification for intrusive regulation. Consider the so-called smoke-free generation, a policy that criminalizes an entire cohort born post-2008 by gradually increasing the legal smoking age until they are entirely barred. For adults past that cohort, the state now proposes to invade outdoor spaces, pub gardens, playgrounds, hospital grounds, imposing legal fences around behaviors that harm no one else. And let's not ignore the crackdown on flavored vapes, an admission that policing taste is part of the package. But let's be clear, this isn't just about filters and tar. It's about who holds the power to decide what is and isn't acceptable. This is Starmer's nanny state unleashed, shrouded in medical rationales, but masking political ambition. He's telling us, your health is our business, your freedom subordinate to the greater good. Proponents claim this is necessary to relieve the NHS, citing strokes, lung cancer, treatment costs. And yes, banning indoor smoking worked, reducing heart attack hospital admissions, evidence even Health Minister Wes Streeting pointed out. But outdoors, is a pub garden cigarette nearly as lethal? Not even close. Yet Starmer persists. He isn't responding to an epidemic of outdoor smoking deaths. He's writing regulations where no crisis exists. His stated aim, reduce chronic disease and protect public spending. But at what cost to freedom? We're told a ban on flavored vapes is crucial to curb underage nicotine addiction. Yet vaping remains the prime tool for adult smokers seeking escape. Removing access risks undoing decades of public health gains. Meanwhile, small business owners brace for the blow. Convenience stores reliant on tobacco revenue could collapse, costing tens of thousands of jobs and billions in tax, an economic noose tightening around local economies. Dr. Magadali's report is unequivocal. Closures, closures, closures. 7,700 corner shops, 70,000 jobs, £23.8 billion in lost revenue, £828 million enforcement costs. A dystopian relay of unintended consequences where the government punishes low-margin businesses to prevent behavior the public is already quitting. And let's not sugarcoat the black market boomerang. Prohibition doesn't eliminate demand, it fuels illegal supply. When cigarettes vanish on store shelves, darker forces fill the void. Criminal profit replaces legitimate tax, while enforcement becomes a resource drain. That's not public health, it's a racket. We should demand smarter solutions, robust cessation support, education, targeted interventions, not sweeping bans. And if we do ban sales to future generations, fine, but keep that generational line firm, focus enforcement there, and leave adults alone. Smoking should remain a matter of consent, not compliance. Some argue that placing the law behind every puff is a proportionate response. But the notion that freedom can be suspended for wellness is perilous. Today it's cigarettes and vapes, tomorrow it's sugar, salt, alcohol, or caffeine. Where do we draw the line? For now, Starmer is building the scaffolding. He's already postponed the pub garden ban, not for principle but politically, snipping at the edges but never backing off the ideology. Next, maybe banning outdoor drinking, limiting fried food ads, controlling caffeine ads. The manifesto's logic is one step from full regulatory oversight of how we live. This is bigger than tobacco. It's about the cultural shift toward government-determined health norms. It's about trust. Does the public trust themselves to make healthy choices, or do they need expert bureaucrats to nanny them at every turn? Starmer's gamble answers that, clearly, for him and for us. He frames it as youth protection, public health, economic prudence. But public support isn't the same as public mandate. The polls fluctuate, the dissent simmers. People understand that liberty is easier surrendered than reclaimed. Our political moment demands pressing questions. Will the UK be a nation of empowered citizens or subjects of regulations in waiting? Will our public health policies respect autonomy or weaponize paternalism? Starmer has chosen his path, institutionalized prevention at the expense of adult freedoms and small business resilience. He'll say it's saving lives, saving money. But it's also reshaping society's relationship with government, favoring control over consent. That's not progress. It's policy dystopia.